Diabetes treatment. In spite of the known advantages of a solid way of life, numerous people think that it's difficult to keep up such a way of life in our cutting-edge world, which encourages inactive conduct and indulging. As a result, the pervasiveness of type 2 diabetes mellitus is anticipated to increase significantly over the coming years. Will advancements in medicines have the option to balance the subsequent effect on bleakness and mortality? The different lines of exploration can be assembled into three principal classes: innovative, organic, and pharmacological. Innovative arrangements are centered around the conveyance of insulin and glucagon by means of a pancreas, and segments of the framework are now being used. Recommending this alternative likely could be accessible in the next coming 10 years. Please, if you are watching this video for the first time, kindly like my video, hit the subscribe button and the bell icon, so that anytime I drop a video like this, you will be notified. Of the natural arrangements, pancreas transfers appear to be probably not going to be utilized generally, and islet cell transfers have additionally been hampered by an absence of proper benefactor tissue and joint endurance after transfer. Be that as it may, huge advancement has been made in these zones, and extra examination recommends controlling other cell types to supplant beta cells might be a practical alternative in the more drawn-out term. The last classification, pharmacological examination, shows up the most encouraging for fundamentally lessening the weight of type 2 diabetes mellitus. As of late, research has focused on decreasing blood glucose, and the expanding pace of examination has been reflected in developing a number of anti-diabetic operators. In the previous years, investigations of the integral methodology of shielding cells from the harming impacts of high blood glucose have additionally been accounted for, as has examination into the control of vitality admission and vitality use. Proof from investigations of dietary limitation and bariatric medical procedure proposes it might be conceivable to reset digestion to adequately fix diabetes, and examination into pharmacological operators that could specifically re-establish vitality balance is at present the most energizing possibility for future medicines for individuals with type 2 diabetes mellitus. Presentation prior to the accessibility of insulin during the 1920s, hailed as the solution for diabetes as well as perhaps the best development in the treatment of any ailment. An individual determined to have diabetes would include confronted passing inside a couple of years. Today, diabetes isn't the overwhelming finding it would have been 100 years prior. Truth be told, it is presently a typical misguided judgment among the open that diabetes is certainly not a genuine ailment. In all actuality, the effect of diabetes is huge to the point that it is influencing general future. In the United States, US, future is succumbing to the first run-through since insights were gathered, because of corpulence and diabetes, and appraisals of diabetes pervasiveness over the coming years propose a significant number of us watching this video will create diabetes during our lives. The forecasts of the expanded commonness of diabetes are once in a while joined by expectations of upgrades in the treatment of diabetes. Be that as it may, given the effect of diabetes, it has been the focal point of concentrated examination, bringing about significant advances in our comprehension of diabetes just as in treatment alternatives. As the centennial of the disclosure of insulin draws near, it appears to be opportune to consider how treatment choices may glance during the 2020s, and the probability that the slippery solution for diabetes could be found at that point. Most of instances of diabetes are type 2 diabetes mellitus (T2DM), and the anticipated ascent in diabetes pervasiveness is relied upon to be driven by increments in the number of T2DM cases. In any case, all things considered, critical advances in treatment for T2DM will result from the examination in type 1 diabetes mellitus (T1DM), as they are both basically issues of glucose. Pathophysiology of type 1 and type 2 diabetes mellitus. Type 1 T1DM and Type 2 diabetes mellitus T2DM are both portrayed by unusually elevated levels of glucose in the circulation system, and until the 1930s, when insulin-delicate and insulin-obtuse diabetes were separated, all patients with diabetes were thought to have a deficiency of insulin creation. From that point toward, the pathophysiology of the two sicknesses has been explored widely, and T1DM is generally surely known. So, the patient's safe framework assaults and crushes beta cells in the islets of the pancreas, bringing about insulin lack. The elements behind the resistant reaction are as yet unsure, however are believed to be both hereditary and ecological. Indeed, even today, the pathophysiology of T2DM is less surely known. At conclusion, most patients have insulin obstruction. The pancreas is creating insulin, yet the body can't utilize it viably. At first, the pancreas repays by creating more insulin, and patients have bigger beta cell mass. Sooner or later, regularly quite a while after analysis, insulin creation will diminish, with a comparing drop in beta cell mass, and numerous individuals with T2DM in the long run need to take insulin. In spite of the fact that the hidden reason is obscure, it is imagined that liver, fat, and muscle cells all assume a job, notwithstanding the pancreatic beta cells. In T1DM, the total absence of endogenous insulin has concentrated exploration on always advanced approaches to convey insulin, with the inevitable objective of building up a counterfeit pancreas. The components are as of now accessible: a sensor to recognize blood glucose readings, a PC to compute insulin necessities, and a siphon to naturally convey insulin. The plausibility of uniting these components has just been exhibited in clinical preliminaries, with sensor-increased siphon treatment. Coordinating a sensor and a siphon appeared to improve glycemic control contrasted in a routine of different insulin infusions every day. A genuine pancreas would likewise convey glucagon to raise blood glucose and forestall serious hypoglycemia, an idea that has just been demonstrated to be doable. A few mechanical moves should be defeated to create a clinically valuable pancreas. To start with, at present accessible consistent glucose screens measure glucose levels in interstitial liquid instead of legitimately in the blood, bringing about a delay before changes are estimated. As an outcome, exactness isn't adequately solid, with revealed blunder paces of somewhere in the range of 12% and 17%. Exactness is probably going to be most minimal when blood glucose levels are low. Henceforth, consistent glucose checking of interstitial liquid is as of now prescribed uniquely as an extra to standard blood glucose observing. Insulin siphon innovation is further developed. All things considered, the present siphons convey insulin subcutaneously, and the postponement while insulin is ingested into the circulation system constrains the capacity of programming to control blood glucose precisely. Catheter difficulties have forestalled intravenous conveyance of insulin, and precisely embedded siphons are costly. Unmistakably, none of these mechanical difficulties are unimportant, yet given the pace of improvements in innovation, we can anticipate more down-to-earth choices for patients inside the coming 10 years. For instance, purported, savvy tattoo, biosensors are fit for recognizing glucose levels constantly utilizing a straightforward infrared locator and giving outcomes progressively. These biosensors, which depend on single-walled carbon nanotubes enveloped by glucose-delicate polymers that fluoresce within the site of glucose, are as of now being explored in creature models. Natural arrangements indeed, even as innovative arrangements advance consistently nearer to pancreas, it is far-fetched that innovation would ever control insulin as definitely as beta cells in a sound pancreas. Examination in this manner proceeds into supplanting harmed beta cells with working cells, or supplanting the whole pancreas. Similarly as with the pancreas, most exploration to date has been directed in T1DM, yet the outcomes will at last convert into treatments for T2DM. Pancreas transfers have been performed since the last part of the 1980s, with in excess of 30,000 pancreas transfers recorded in the previous 25 years. On a fundamental level, pancreas transfers offer the guarantee of fantastic results for patients with diabetes. In fact, stricter giver standards, just as upgrades in careful procedures and immunosuppression, have prompted improved achievement rates, with most of patients done requiring insulin treatment after the transfer. Practically speaking, by far most of pancreas transfers are done in patients who have end-stage renal sickness and furthermore need a kidney relocate. This is incompletely because of the lack of benefactor organs, yet in addition in light of the fact that the dangers of the vital post-relocate immunosuppressant treatment as a rule exceed the well-being dangers of diabetes itself. A less obtrusive alternative that has just been demonstrated to be suitable, at any rate for certain patients, is supplanting pancreatic beta cells by means of islet cell transfers. Disconnecting these from a contributor pancreas and mixing them into the patient's gateway vein has been investigated since the 1960s, and a fruitful convention utilizing islets from different benefactors, improved cell culture methods, and decreased harmfulness was advanced during the 1990s at the University of Alberta in Edmonton, Canada. Utilizing the Edmonton Convention, beginning investigations detailed achievement. In any case, after some time relocated islets lose capacity. Patients despite everything require immunosuppressive medications, which are known to build the danger of contaminations and the rate of threat, just as being poisonous to the islet cells themselves. The treatment is as yet thought to be test and is just accessible to patients with poor glycemic control and serious hypoglycemic occasions in any case, Given the advantages of a fruitful treatment, there is critical drive to conquer the difficulties of constrained accessibility of contributor tissue and unite endurance after transfer. Additional information: I have dropped a link below for the best diabetic treatment. If you have any questions, please comment below, and I will respond immediately. Thanks for watching.